And the rising number of COVID cases statewide is also being seen here in North Alabama, and state health officials say more antigen tests will be available. Our Kenesha Dees has more on what this means for the Tennessee Valley.
We have seen over the last few weeks an increase in our probable cases.
Dr. Karen Landers with the Alabama Department of Public Health clarifying what the probable cases mean and why they're increasing. She says the increase in probable cases is a result of positive antigen testing.
And again, antigens are considered in the probable case definition based upon the sensitivity and the specificity.
Landers says the antigen tests have become more widely available.
More places are using antigen point of care testing.
She says the probable cases will be included in the state's data.
As we go along in the state of Alabama, we will see more probable cases being included on our dashboard and in our information.
However, Landers says there are some pitfalls with the antigen tests.
So you have to be aware that while a positive means that you have COVID-19, a negative does not necessarily rule out COVID-19.
There's also challenges for certain entities, including urgent care centers, to use data.
Some entities prior to SARS-CoV-2, prior to COVID-19, were not accustomed to reporting notifiable diseases to the Alabama Department of Public Health.
Landers says the health department is working to make sure that these entities are able to report both negative and positive results.
We are working with these entities to be able to capture the positive and negative tests that are being done.
Dr. Landers says both positive and negative results should be reported because it helps produce more accurate data on percent positivity as it relates to community transmission. Putting the Valley first, Kenesha Dees, WZDX News.